Tonight, the Delta variant fueling an alarming rise in cases across this country. Authorities say those ending up in the hospital and the rise in deaths largely among the unvaccinated. But this is affecting the vaccinated too. So-called breakthrough cases, not as severe, but it's happening. And with the school year set to begin, the growing debate tonight, should everyone in schools be wearing masks, given the millions of school children 12 and under who aren't eligible for a vaccine yet? Tonight, the American Academy of Pediatrics now breaking from the CDC and recommending that all students wear masks, even the teenagers who've been vaccinated. COVID cases rising in 48 states tonight, averaging about 30,000 new cases a day in this country. And take a look at the map from the CDC tonight, tracking cases in just the past month. The red areas on the map showing where the virus is spreading most quickly. Many of those areas where the vaccination rate is low, hospitals in those areas struggling to meet the need tonight. And that new guidance from the American Academy of Pediatrics will no doubt lead to more questions for parents about what to do. Also tonight, the State Department warning about travel to the UK, the alarming numbers there. And the Olympics tonight, just days away, 2 more American athletes testing positive, more than 60 in the Olympics bubble positive for the virus. ABC's Steve Osunsami leading us off tonight from the CDC in Atlanta.
Public health officials tonight are frightened by the direction the numbers are heading. New COVID infections in the United States are now averaging about 30,000 cases a day, and it's because of the Delta variant of the disease. Nearly every state except South Dakota and Wyoming is seeing the number of new cases starting to rise again.
Virtually all hospitalizations and deaths are occurring among unvaccinated Americans. These tragedies are avoidable.
The numbers are where we were last fall, long before the vaccines and before the average number of new cases multiplied months later. The CDC is sharing this map tonight to make a point. The areas in red are places where the virus is now spreading the fastest, and these happen to be many of the same places where vaccination rates are the lowest.
Most people will either get vaccinated or have been previously infected, or they will get this Delta variant. And for most people who get this Delta variant, it's going to be the most serious virus that they get in their lifetime in terms of the risk of putting them in the hospital.
A doctor at a regional hospital in Arkansas has recorded this plea to the community, saying that his new patients who had refused to get vaccinated are now wishing they made a different decision.
The regret and remorse on their face and fear. I can't show you, I can't describe.
There's now a new push for wearing masks. In Los Angeles tonight, they're required to be worn indoors again. And with school, with in-person instruction set to start in a few weeks in many places, a leading pediatrics organization is going against the recommendations of the CDC, telling parents that students and teachers should all be masked up because so many students aren't yet allowed to be vaccinated. Adam Joseph, a meteorologist at our station WPVI in Philadelphia, understands the concern.
We kind of feel like we failed as parents.
He and his husband are vaccinated, but his kids are too young to get the shot. He says he invited an unvaccinated relative to his home who later tested positive for COVID-19. His children are now sick, and so is their nanny.
Please, if you are not vaccinated, do not go around children who are under 12. They are so vulnerable right now.
And so let's bring in Steve Osunsami with us tonight. And Steve, with the Delta variant spreading here in the U.S., it's something we're seeing elsewhere, too, in the U.K. tonight, the alarming numbers there. And in fact, the CDC and the State Department tonight warning Americans that they should avoid traveling to the U.K.
That's right, David. This is the highest level of travel advisory from authorities here at the CDC, a level 4. And it's because of the large number of new COVID cases they're seeing in the UK every day, about 50,000 new cases a day. That's a lot more than what we're seeing in the United States, in a country that is a fraction of our size. David?
Steve Osunsami leading us off tonight. Steve, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos,
that is to stop movement around our state, let the contact tracers get in touch with every single potential person who has come into contact with this disease, put them into quarantine, isolation, have that testing, and making sure that we can stop this disease dead in its tracks here in South Australia. Look, it's It's difficult to speculate on that. I might leave that to Professor Nicola Spurrier. Yesterday, I said that I was hopeful that it would be contained to the people that had already been put into quarantine. That was the situation with the 4th case. This 5th case is far more worrying. Correct. When do you expect international arrivals? That would be something that we would have. We've significantly reduced at the moment, so that would be something that we'd have to discuss with the federal government. When do you expect that the Treasurer to arrange whatever it is that's going to be arranged for businesses? Well, we had a meeting this morning about it. So look, this is very, very fast moving. We understand there'll be lots of pain points right across the state. We're trying to, number one, control the spread of this disease, and number two, to support businesses and individuals who have been affected. Are we talking hours, days? Certainly in the next 24 hours. And why don't we have a contingency fund? The opposition, Business SA, has been calling on us for at least 6 months. But we're 18 months in, why isn't something already organised? Well, let's be very clear. In South Australia, we've put $4 billion worth of stimulus and support to support businesses, individuals, and our economy in South Australia. We now have a changed situation with this Delta variant active in our state. We will look to announce that in the next 24 hours. We obviously call upon the federal government for their support. I spoke to the Prime Minister about that this morning. We expect to get the same level of support as has been shown to both Victoria and New South Wales. But I'm also still very hopeful that we can have this 7-day lockdown situation and then emerge from that and get people back into working in our economy as quickly as possible.
Premier, is there any provision for essential workers, what they do with their children for childminding facilities?
I might leave that up to the Police Commissioner or Nicola Spurrier to answer. I don't have that information at the moment, but in the first wave, we did have a situation where some schools, a limited number of schools, would stay open for exactly and precisely that purpose. No, look, we have different levels of isolation. Of course, we have directed quarantine, where we can say to somebody who we believe needs to not leave home under any circumstances, and there are hundreds and hundreds in that category. There'll be hundreds added to that again. I don't have an update on the number, but as of 6 p.m. tonight, look, quite frankly, the entire state will be in a situation where they need to stay at home, except for very, very limited reasons to leave the home. As I said, for medical reasons, to support somebody from a compassionate perspective, some very limited exercise, and to purchase goods that are essential to their survival at the moment.
There were some issues last night with our ambulance service as a result of the isolation orders that were placed from SA Health. The union and others have come out this morning that raised some very significant concerns about the reduced capacity across the network. Can I get your thoughts and reaction on that, please?
Look, I think originally we had 26 ambulance officers in South Australia who were put into quarantine. I think this was reduced down to about 12 overnight, but it did put strain on the situation. We did meet with the union yesterday. I thought that meeting was very positive and that they understood the situation that existed. But obviously, we want to get as many people back and operational as quickly as possible.
And what about elective surgery? What's the deal with that going for the next 7 days?
No, look, we're really trying to very, very significantly reduce movement to give ourselves the very, very best shot of getting on top of this and stopping this disease dead in its tracks. The reality is we are dealing with a different variant than we were back this time last year and with the Parafield cluster. This is highly transmissible. We've seen this in Victoria. It's been moving extraordinarily quickly. We don't want this moving right across our state at the sort of exponential speed that we've seen in other jurisdictions, and that's why we take this action today.
What are the rules on exercise? Is it just within your area? Can you drive, an hour to the beach to go for a walk?
Look, I'll let Professor Nicola Spurrier answer that. But look, if you think about the logic of what we're trying to do, we're trying to limit movement. That's the overriding message to the people of South Australia. If people significantly reduce their movement around South Australia, then we will significantly reduce the likelihood that this is going to spread statewide. So the concept of people driving 2.5 hours to get some exercise just doesn't make any sense from a medical perspective whatsoever. And we're just asking people, like they have since day one, to work with the government, work with SA Health, work with SA Police to make sure that we can put ourselves in the best position to stop this disease spread in our state.
What happens to people who are already away? Do they need to Wherever they are at the moment, is that where they have to stay for 7 days, or can they get home today before 6 and stay there?
Well, the orders come into effect at 6 o'clock tonight. And so we're just making sure that people have got some time to get to where they need to be and be comfortable for that period of time. They will be able to leave home for exercise, for compassionate reasons, to go and purchase those important supplies that they need after 6 o'clock tonight. But beyond that, we really significantly want to reduce movement around our state.
So wherever you are at 6 o'clock tonight is where you stay for 7 days.
Correct.
Can I just
So they're saying there's another outbreak. So I would protect yourself, protect your family, and I'd pay attention. Thanks for coming, guys. Like and subscribe. Hit the bell icon so you know when I go live. Thanks for coming. Love ya.